Did you know how you connect with others can have an impact on your heart health?
Well, joining us to explain some of those impacts is KCU Assistant Professor of Primary Care, Dr. Nicole Fremarek. Good morning, Dr. Nicole.
Good morning.
So happy to have you here this morning.
Thank you for having me.
Really appreciate it. Okay, so with Valentine's Day coming up, you know, we all kind of feel those big emotions like love or even stress. How can that affect our heart health?
So similar to running a marathon or having a really stressful day, any time that stress comes into the body, whether it's good stress or bad stress, that can impact heart health. It can impact how your body responds. I like to think of it as kind of think of your gas pedal and your brake in your car. We call it, the fancy term is the autonomic system, and that when your body is constantly doing this back and forth, it doesn't know how to regulate as much. And so we want to work on trying to manage that from all aspects of our life.
I like
Wow.
that. That's a good
It
analogy.
kind of sounds like our weather right now and what it's doing to all of our nasals and coughs and everything like that.
Sinuses.
Like we want to be in spring, but we're not there quite yet.
Right. Exactly. I saw a bee buzzing around me the other day, and I was like, no, it's too early. Let's talk about social connections here, and I'm wondering if you'd share some scientifically proven methods on how social connections can improve our heart health.
Absolutely. So there are some studies that have shown that just having a good social network in and of itself can reduce stress and improve cardiovascular health up to about 25 to 29%. And then actual good social integration, so really getting out there, and variability of the social groups you have, anywhere from, I believe it was about 20 to 50% improvement in heart health as a whole. So, and then things like in elderly patients, having contact with people can be really helpful.
Absolutely.
So there's lots of different ways that those social interactions can be good. Now, of course, if those are adding stress to your life, maybe those are impacting you in a different way. So we're looking for good positive impact. I like to say kind of finding people that fill your cup, doing things that fill your cup.
I like
Great
that.
way to put it, yep.
Add the positivity.
Yes.
Take out the negativity.
As best you can.
As best as you can, yeah. So talking about short-term and long-term stress, right? Maybe we have a deadline coming up, or with Valentine's Day around the corner, we're feeling even more stressed out. I don't know, is there a difference on how that impacts our heart health short-term, you know, versus long-term?
Yeah, about 20% of cardiac arrhythmias, so those are when you get really irregular beats, and those are kind of the big, bad, scary things you see on television shows. Those particular ones can be, about 20% are instituted by acute high-stress moments. Maybe not the deadline or those smaller work-related stresses, but bigger life stresses. There's actually a syndrome, we colloquially refer to it as broken heart syndrome, that actually is precipitated by high emotional stress. And so certainly acute versus chronic stresses can really make an impact on your heart health.
Okay, we just talked about social and those types of things. What about physical touch? How can physical touch impact our heart health?
Yeah, so as an osteopathic physician, I might be a little bit biased. I do osteopathic manual medicine on a regular basis, so I get to see the benefit of how just laying hands as a physician on someone can impact their mood and health. But certainly there have been studies that show that you can improve and decrease cortisol. That's that kind of thing that riles you up. That cortisol levels can come down when you have something as simple as holding hands or a really good hug. So I have a friend of mine from college. I remember she gives the best hugs. So it always made me feel better. So, you know, I think that we know that anecdotally, but we also have seen that in the science as well.
You have to have a friend that gives good hugs. I have one, and I'm just like, don't let go.
Yes, yes.
What are some ways that people can strengthen their heart health right now?
I think anytime you can get out there and be physically active safely, but also things that, again, can fill your cup. So seeking those meaningful experiences and meaningful connections. So whether that's getting out there and being creative and going to a pottery studio and painting for the afternoon, or going for a really long walk, or just making a dish. Things for events for Valentine's Day or just in general don't need to be expensive. They can just be things that you enjoy doing with people you enjoy doing them with.
I like that.
Do you recommend the headphones with headphones or without headphones when you're walking?
That's a really difficult question. I know people who do both. I think if you are going to do it safely, you should always have one ear that is open.
Okay.
I'm a person that sometimes that fills your cup if you're in your neighborhood and you're on a sidewalk and you're safe. I think as long as you can safely hear and you're not blaring in your ears, I think that's okay. But I wouldn't be like walking on the side of the road with headphones in where it's not, you're risking more than just your heart health in that instance.
That's very true.
Yep. Well, Dr. Nicole Fremarek, it's great to see you as always. Look forward to our next visit.
Yes.
If people would like to learn more or get in contact with you guys, how can they reach you?
Yeah, so by reaching us through Kansas City University, that's one great way to do that. I see patients in the community as well, and you know, anytime you're looking for someone that does osteopathic medicine, going through the AOA or the American Academy of Osteopathy.
Okay, appreciate it.
Thank you so much.
welcome.
So happy to have you.